Please welcome TechCrunch Managing Editor, Matt Burns.
Hey! You guys are back for day 2. I really appreciate that. Thank you so much. Yesterday, we saw some amazing companies. We saw a company turning excess heat into batteries. We saw a company that's using AI to develop teacher lesson plans. We saw so many different things. 10 companies, so not that many. Today, you're going to see 10 more companies, and these companies are going to compete for the same $100,000 check from TechCrunch. Let's go over the judging criteria one more time. These companies are going to, or the judges are looking at the companies and evaluating them based on the potential for social or financial impact. We don't care if the company's not going to make a lot of money, as long as they're changing the world, that's what we're looking for. So let's get going. The companies are going to have 6 minutes to present, followed by 6 minutes of a Q&A from the judges. I'm going to bring out the judges right now. I'm going to read their bios, and then we're going to start the competition. Come on out, judges. Okay. These are some impressive people. First up, we have Jacob Androl, from partner at Greylock Ventures. Jacob is a product executive and builder who backs founders building the next generation of consumer software. Prior to joining Greylock, Jacob spent 8 years at Snap, where he helped scale the company from its early days. For most of his time at the company, he ran teams of several hundred people across the product design, growth, data science, and analytics, and user research team. Most recently, he launched My AI, Snap's own AI chatbot powered by ChatGPT. Next, we have Guru Chahal, partner at Lightspeed Ventures. Guru is a visionary investor with a passion for revolutionizing digital landscapes. Since 2012, he has been an instrumental force in Lightspeed, spearheading early investments in groundbreaking companies. Guru's dynamic journey led him back to Lightspeed in 2019, where he continues to make astute investments in cutting-edge ventures. Next, we have Rebecca Lin, co-founder and general partner at Canvas Ventures. Rebecca leads the early-stage investments in fintech, health tech, and AI. Rebecca's very first entry into venture was leading an early-stage investment in Lending Club, which turned into the largest U.S. IPO of 2014 and the 4th largest U.S. internet IPO since 2001. Next, we have Surabhi Sarna, group partner at Y Combinator. Surabhi, the founder and former CEO of Envision Medical, which developed a first-in-kind microcatheter for the detection of ovarian cancer. After raising $17 million in venture funding, completing 3 clinical trials, and obtaining 2 first-in-class FDA approvals, Envision was acquired by Boston Scientific for more than 15x money in. Surabhi stayed at Boston Scientific for 2 years, running the 150-person commercial organization in preparation for launch. She sits on both private and public company boards. Next, we have Nikita Shamgunov. Nikita is passionate about deep tech, data infrastructure, and system software. At Coastal Ventures, Nikita is incubating Neon, a new database company building serverless Postgres that raised $50 million in its seed and Series A rounds. Prior to Coastal Ventures, Nikita co-founded SingleStore, a data unicorn and analytics company valued over $1.3 billion. He served as a founding CTO and then CEO, successfully scaling the company to over $40 million in ARR and near profitability. Give these judges a round of applause. Now, before we bring out the first company, I need a favor from all of you. The energy is so important in here. These companies have worked very hard over the last 4 months. They've been trained by TechCrunch editorial, given mentoring from venture capitalists as well. They know their pitches inside and out, but they need your help bringing the energy. So we're gonna bring out the first company, give them a very loud round of applause, and let's get going. So, hold that pause 1 second, I'm gonna read something, then it's your turn. From London, England, we have Untap Health. Presenting from Untap Health is Dr. Claire Trant and Dr. Jay Bullen. Round of applause.
Untap Health is a completely new way to prevent infectious disease outbreaks at the building level. We detect illnesses before symptoms using our sewage.
Let me tell you a story. It's a story of humans' fight against disease and death. In the 1700s, next slide, please. In the 1700s, we had yellow fever and bubonic plague. Next slide, sorry. Then cholera, plagues, and the flu. Next click. Spanish flu, typhus, HIV/AIDS, polio. SARS, MERS, Ebola, swine flu, COVID-19, Mpox. COVID-19 was not a one-off. Since 2000, 30 million people have died from communicable disease. And every year, the chance of another pandemic is only increasing due to globalization and climate change. There has to be a better way of detecting illnesses. At the moment, it takes weeks to detect illnesses because many people don't even show symptoms. This means that illnesses are moving silently amongst us, disrupting our businesses and our lives. At the moment, we aren't detecting illnesses at all before symptoms. We are then doing it manually by doing PCR tests. There has to be a better way. That's what we're doing at Untap Health, providing a better way without testing whole communities. Next slide. Sewage surveillance has been used for 80 years. It's an incredible tool. You measure a whole community with a single test. Even better, you can detect illnesses right from the beginning of infection, if they're symptomatic, asymptomatic, or pre-symptomatic. Best yet, you can detect one sick person in 10,000 people. Next slide. But at the moment, it's manual. A person has to take a sample from the sewer, drive it to the lab, then analyze it and send the data back. This means the data can take up to a week and cost up to $1,000. It's too expensive. And it means when an organization like the CDC gets their data, it's already too late and outbreaks already happened. This means the technology has been limited to governments at times of only desperate need. There has to be a better way. Untap Health is providing plug-and-play, automated, end-to-end hardware and software solution that can be installed into any and every building. Our product can detect up to 12 pathogens. But how does the hardware actually work? Unfortunately, it's currently stuck in customs, so we can't show it here today, but we have a video instead. Our hardware is a multi-stage technology automating the gold standard lab workflow for sewage surveillance. It has multiple patents pending. It consists of 3 stages. The first stage is sewage filtration. What usually happens in sewage filtration is you reject the dirty sample and you keep the clean. We're doing the exact opposite. We're keeping the dirtiest sample. We filter hundreds of liters of water each and every day, meaning we're casting a massive fishing net. We're detecting more illnesses than ever before from sewage, and we've got higher detection limits. The system then uses the clean water to self-filter so it can be done for the next sample again. The second stage is RNA extraction. This is a clever mechatronics approach which provides a purification and washing step of that sewage sample. This is again cleaned for the next stage, which is PCR analysis. This quantitative PCR analysis completely turns on its head current PCR. At the moment, what we do is we test lots of individuals in batches. We do a continuous time series collective PCR testing system. This data is sent directly to customers that day. This means that data can go directly to organizations that need it most. Care homes, offices, factories, and so much more. Move to data dashboard. Move to dashboard demo. Yeah, there we go. This is the dashboard that customers see. This is actually from a customer site. You can see that here they've got low norovirus, influenza, and RSV levels. But their COVID-19 is an increased risk. They can then click through onto their COVID-19 page and see personalized insights which provide them with their risk levels and ways to prevent outbreak happening. This means that workplaces can find out when they're at increased risk of COVID-19 or flu pandemics, like we've seen every year in workplaces. This means they can reassure workers back into the workplace when their risk is low. For norovirus, you can detect symptoms illnesses 2 days before symptoms. This causes death every year in nursing homes across the world. These can be prevented. Back to presentation. As we speak, we're detecting COVID-19 in workplaces and norovirus in nursing homes. This step change in technology means it can be a preventative healthcare solution for so much more. Talking about chickenpox on cruise ships, strep A in schools, and even antimicrobial resistance, bacterial infection. And actually, sewage has even been proven to detect early some cancers and stress. Next slide. Next slide. In 2019, gastrointestinal infections and respiratory illnesses cost the UK and US economies $45 billion. That was before COVID-19. Our UK market size is $2 billion, and as we scale to the US, it's $26 billion. But the true value here is in the data. Collect enough sites across a city, a country, the world. Those data insights can be used to guide preventative healthcare solutions, insurance policy, public health policy, and so much more. This is not a niche healthcare play. This is a $1 trillion unrealized market opportunity. Next slide. If you or your organization needs our technology, please come and find me after the presentation. We are Untap Health, and together we're safer with crap data.
I love when we start the morning talking about poop. That's great. Okay. Rebecca, let's start with you.
Yeah, I mean, I'm super skeptical that anyone cares enough. So during COVID, probably the smartest thing I saw everywhere was just a simple temperature reading. I lived in Hawaii, and they would just do a temperature scan when you came on and off the plane, and they would do that in the restaurants, and they've taken all that down. So if that sort of super easy, minimal scan isn't even being done on airlines today, why do people want to buy this?
Yeah,
and,
sure.
and do they actually care?
Yeah, great question. So the problem with the temperature scanners is they didn't actually work. So we saw that people coming in were hot from vans, and they were just a bit too warm, went outside for 10 minutes, came back in, the temperature scanner worked. The technology didn't actually have any real use, sadly. However, why they actually care about our tech is norovirus does kill people in nursing homes every year. That's a cost. They're losing time in beds, which is money, which obviously is important. But we've also found that workplaces, they don't want people to work from home anymore. And getting people to come back to the workplace, they're doing anything they can. You see the Deliveroo on Fridays, or you see all these different small things, reassuring people they're actually going to be safe if they're caring for someone that has got immunocompromised or their family have got cancer. 1 in 2 of us will have cancer in our lives. So to be able to reassure those people as well back in is a real thing. Thank you.
Guru?
The equipment actually gets installed in a sewage treatment plant, but the benefits are accrued to someone else. It could either be a government who's looking for analytical information or a care home, et cetera. So how do you solve this problem of who pays, who do you sell to, versus where the equipment is actually installed?
Yeah, sure. So the equipment itself is installed directly on a building. So we're talking at the building site. The building site itself directly pays for a monthly subscription to the data. The data then, imagine you've got 10, 20, 30, a million sites across the world. You can aggregate and do smart big data on those aggregated sites, and that's where the real value comes in. The benefit is to the direct care home, but the big data can be used for so many things. I hope that answers the question.
So putting the skeptic in me as well, so it's clear that at scale, there's a ton of value because you have this wonderful monitor of everyone's diseases everywhere in the world. But in the in the early stage, doing things that don't scale, how many units have you sold already, and how long does it even take to sell one unit to someone? Should it be a care home or a building? Because somebody else needs to be buying and writing a hefty check for that.
And what does it cost, right?
Yeah. How much does it cost?
So the costs, obviously, we don't want to disclose too publicly because we know some of our competitors are here.
Ballpark.
Our margins are over 70% for the hardware already. It's in the thousands. We've made it so it was cheap, cost effective to build. That was one of our main drivers, and also modular, so very easy to redesign for future pathogens of interest. They were the core drivers of building the technology. We've already had interest from massive international hotel chains, international workplace management companies that are in the UK and US, care home groups. At the moment, we don't have many devices because it's a young company, so we can't install them in all those places yet. But next year when we're raising, we'll be able to scale and put them in all the places that are interested.
Surubi?
Yeah, thank you guys so much. Out of the 12 pathogens you're detecting, what are the two most important, and are you optimizing for sensitivity or specificity?
Jay?
Yeah, so we're really interested in providing a mix of biomarkers. So, say Claire mentioned norovirus is a really critical one for care homes where your incubation time's really short, maybe just 24 hours, and you can spread it. So obviously you're interested in any detection at all. And then things like influenza, COVID, other respiratory illnesses, where you're looking a bit more at quantitative data. What we're finding with our technology is we're achieving similar comparable sensitivities and detection limits as manual, currently available commercial manual on-site testing methods, because we use the same reagents, the same assays, and our contribution, our development, is the mechanical process automation to achieve that without, hands in gloves.
I'm sure
We'll go to Jacob real quick, and then Rebecca has one more.
Can I just?
Yeah, please.
So I'm sure this is a solvable problem. I'm a little bit concerned that the actionable things that you mentioned you could do with the data, like having people return to work, then you want to optimize for specificity. But if you want to make sure everyone's safe at sensitivity, so how do you do that with a single diagnostic test? If you're saying we want people to come back as quickly as possible, then you don't want your test to be too sensitive, right?
Okay. Yeah, so our analytical, our downstream analysis is qPCR analysis. So obviously we get a CT number which converts into gene copies per milliliter, and we categorize it in bins. So, to say, okay, well, we had a trace, an environmental trace, probably not an active carrier on site. And then moving up, you go through all orders of magnitude, and then you go to the next bin where you say, okay, someone is actively contributing this biomarker to my catchment.
As a quick follow-on, very interestingly, our customers don't really care if it's COVID, RSV, or flu. They care it's a respiratory virus because the actions are the same, which has been absolutely fascinating. Actually, detecting COVID isn't necessarily a good thing because of the fear. If you say you're increased risk of respiratory virus, it's more actionable.
Yeah, I mean, I'm still super skeptical. My school knew that strep and mono was going on, and I mean, they just tell kids to wash their hands more, right? So I'm still super skeptical. Sorry.
Just quickly, what's the process for onboarding new pathogens? Obviously, you guys have 12 today. Is it a physical process? Do you have to go to each of these units, or are you able to digitally? What is that kind of
Quickly, please.
Yeah, so the devices require servicing to replace chemicals. So, for instance, PCR master mix chemicals. The hardware stays the same, and the reagents, the selective parts, primers, probes, they get replaced in the servicing model.
Well, thank you very much. Give them a round of applause.
Okay.
Thank you.
I love the tough questions. Thank you so much. Appreciate it.